Thank you. I'm Merrill Gay. I'm the director of the Connecticut Early Childhood Alliance. Today we've heard troubling news out of Washington about cuts that are impacting Head Start and could impact other early childhood programs as they work through the budget process. We've heard three different perspectives from a parent, from a center-based child care teacher, and a family child care provider, and we've heard from some of our champions here in the legislature. This year there are three major bills that would transform child care. The first comes from the governor about universal preschool. Then there's one from the Speaker of the House, 5003. And then there's one from the Senate leadership, SB 1. There are things in all of those bills that we like, and we know that the negotiations among those three power centers are just about to start. So I want to say as clearly as possible what the Alliance supports. The Alliance supports high-quality early childhood education for all of Connecticut's children. That means more subsidies to make care affordable for families and investment in facilities to grow the system. Early care and education must be provided through a mixed delivery system. That means not all in public schools, not all in centers, but families ought to have the choice of whether I want to put my children in a family child care, in a center, or a school. And as we work to make preschool universally available, we need to be very intentional to bolster the infant-toddler care system. There are far too many examples of other cities and states that have tried to do universal preschool quickly and have managed to muck it up and decimate the infant-toddler care system. So we need to intentionally strengthen both at the same time. Key to quality early childhood education is investing in the early educators working with children every day. On average, early educators earn some of the lowest wages in the economy. Many work for minimum wage without any benefits. Programs would like to pay their staff more, but they simply don't have the revenue to do it. Parents, their customers, can't afford to pay more, and that's why the government needs to be part of this equation. Early educators need better pay, health coverage, and care for kids coverage to pay for care for their own children. I've talked a lot about child care, but Connecticut families need it to both be affordable and, in addition to child care, we also need a refundable child tax credit. Finally, I have to say a few words about Medicaid, or Husky as we know it in Connecticut. The threats to Medicaid from Washington are dire. The threats, we can't let that be a reason why we don't do what's right here in Connecticut. We need to address the rates that have been stagnant since 2007. Those stagnant Medicaid rates have been strangling the birth to 3 system. We've already lost 2 providers this past year, and we need to address that so that we can strengthen that early intervention system. And then we also need to address the fact that children who have a medical need for diapers aren't able to get them through Medicaid when adults can. So we need to have that parity in the system. So I'd be happy to answer any questions from the press, if there are any. Okay. And now it is time for all of us to go over to the Capitol building and talk to legislators. I want to make sure that everybody stops by the Lakeshore Learning mini preschool classroom at the top of the escalator. If you've brought kids, yes, they can go play in that space. We want them to enjoy it. And I'm really excited about all the people who are here today. Let's go out and talk to legislators and make them understand why it's important that they get something done this year. Thank you, everybody.